The first thing I want to say is that some things haven't changed. We're still saying wash, wash, wash your hands, sanitize, sanitize, sanitize. Don't give up on that at all. When it comes to social distancing or physical distancing, I think we got to tighten our belts. We all have to stop taking risks and stop taking risks with other people. That means don't be in the same room with other people unless you have to be. We all have loved ones. We have loved ones who are ill. We have people in crisis. We have people we want to help and be with. But let's be smart about it. Let's ask ourselves if we really, really need to do that. As you and probably most of the people in the province know, we've had a major outbreak of COVID just north of our city. 2 comments. First of all, people were within the guidelines, the legal guidelines, when the event was held. I think that illustrates how following the letter of the law doesn't always protect us. So don't look at the guidelines to decide if you need to get together or not. Ask yourself, how badly do I need to get together? The other thing I want to say is that our local medical health officer, Dr. Chokani, and his team, and right up to the provincial level, are taking this very seriously. If you are feeling unwell, you have the same options that you've had now for a few days. You can call 811, bearing in mind that you might not get a call back right away. It may be a couple or 3 hours. Family doctors are still manning their phones. There is help for them to help decide whether or not you need to come into the clinic. We know that the majority of issues, certainly in the short term, can be dealt with by physicians over the phone. The same, in fact, applies for specialist appointments in offices. And don't forget our provincial website, saskatchewan.ca/coronavirus or /COVID-19, has up-to-date information all the time. So what's happening that's new right now? Well, we are preparing for the worst. We don't want to see that happen, but we've got to be ready for it. We know from experience all over the world, including New York most recently, preparations were nowhere near enough. There's nowhere in the world where somebody has said, we did too much, we prepared too quickly, we ramped up too quickly. But we're hearing lots of the opposite message. So here in Prince Albert, in this area and all across the province, people are working literally day and night to get ready. We hope you are too. What are we specifically doing? We're looking at what we're going to do in hospitals. We're looking at how we're going to provide care in communities. We're all going to have to find different ways of doing business to make sure that we can deal with this. So please be patient with us, knowing that as physicians, nurses, and the host of the healthcare team, including the administrators, are doing everything we can so that when things do get worse, we can be as ready as we can possibly be. So please, support us in every way you can, support each other, and we're going to find a way to make it through. Thank you.